Ipilimumab, also known as Yervoy Vial, is a medication used to treat various cancers. It belongs to a class of drugs called monoclonal antibodies, and it works by slowing down or stopping the growth of cancer cells. It's important to note that this medication can have serious side effects in other parts of your body, so it's crucial to be aware of these potential risks. It is recommended to take this medication as prescribed by your doctor, and it's important to discuss any concerns or questions with your healthcare provider. Remember to always follow the recommended dosage and timing for the best results. Before you start using Yervoy Vial, make sure to read the medication guide and patient wallet card provided by your pharmacist. It's important to carry the patient wallet card with you at all times and show it to all your healthcare providers. Yervoy Vial is given by injection into a vein, usually over 30 or 90 minutes as directed by your doctor. The dosage and treatment schedule will be based on your medical condition, weight, and response to treatment. To decrease the risk of side effects, your doctor may prescribe other medications to take along with Yervoy Vial, so make sure to follow your doctor's directions for all your medications. Infusion reactions may occur while you are receiving this drug, so it's important to tell your doctor right away if you experience symptoms such as shortness of breath, feeling faint, dizziness, or fever. Remember to use this medication regularly to get the most benefit from it, and it may help to mark your calendar with a reminder for the best time to take it. If you experience tiredness, nausea, or vomiting while using Yervoy Vial, it's important to tell your doctor or pharmacist right away. It's important to note that this medication can cause serious side effects in various parts of the body. However, your doctor has prescribed this drug because the benefits outweigh the risks. Your doctor will closely monitor you to decrease the risk of serious side effects. Seek medical help immediately if you experience any of the following very serious side effects: persistent headache, signs of intestinal problems, signs of liver disease, unusual bleeding or bruising, unusual weakness, mouth sores, numbness or tingling in hands or feet, signs of thyroid problems, changes in mental/mood, changes in sex drive, signs of kidney problems, increased thirst or urination, dizziness, fainting, eye pain or redness, vision changes, signs of lung problems, seizure, muscle pain, hearing loss, or night sweats. While a serious allergic reaction to this drug is rare, seek medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, be sure to contact your doctor or pharmacist. Before using Yervoy Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to Ipilimumab. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history, especially if you have had an organ transplant, stem cell transplant with donor cells, or immune system disorders such as Guillain-Barré syndrome, lupus, sarcoidosis, Crohn's disease, or ulcerative colitis. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Additionally, if you are pregnant or planning to become pregnant, you should not use Yervoy Vial as it may harm an unborn baby. Your doctor may order a pregnancy test before you start this medication, and it's essential to use reliable forms of birth control while using this medication and for 3 months after the last dose. If you become pregnant, talk to your doctor immediately about the risks and benefits of this medication. Furthermore, Yervoy Vial can pass into breast milk, so it's not recommended to breastfeed while using this medication and for 3 months after stopping treatment. It's important to consult your doctor before breastfeeding. When taking Yervoy Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your healthcare provider. This includes prescription and over-the-counter medications, as well as herbal products. Do not make any changes to your medication regimen without consulting your doctor. One product that may interact with Yervoy Vial is vemurafenib. Be sure to discuss any concerns or questions about drug interactions with your healthcare provider. If you or someone else has taken too much Yervoy and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. During your treatment with Yervoy Vial, your doctor may require you to undergo certain lab tests to monitor your liver, thyroid, and kidney function, as well as your ACTH blood levels. It's important to attend all scheduled medical and lab appointments, and to consult your doctor for further information. When taking Yervoy Vial, it is crucial to follow the prescribed dosing schedule. If you happen to miss a dose, it is important to consult your doctor or pharmacist immediately to establish a new dosing schedule. This medication is typically administered by a healthcare professional. The dosage is based on your medical condition, weight, and response to treatment. It is usually given every 3 weeks or as directed by your doctor. This medication is typically administered in a healthcare setting and is not intended to be stored or used at home. It is important to follow the prescribed dosage and schedule as directed by your healthcare provider. Yervoy Vial is used to treat certain types of cancer, such as melanoma, and works by helping the immune system to attack cancer cells. The dosage and timing of administration will depend on your specific condition and medical history, so it is important to consult with your healthcare provider for personalized guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.